Bismillah ar-Rahman ar-Rahim. Thank you very much for having me in this marvelous conference. And primarily, I would like to thank my friend, my brother, Dr. Said al-Kashif, for this warm invitation to be here among you in Qena. And I appreciate the effort that had been done by the Qena Fever Hospital in order to improve the quality of medicine, not only in Upper Egypt, but also in all Egypt. Thanks for the organizing committee to show up this conference like this. Primarily, as Dr. Shazli told, that the distributions of the HIV is too much increasing nowadays, and we want to focus on that. In Baba Fever Hospital, the story started when we had faced a patient coming to our hospital. He was 29 years old, complaining of fever for more than 3 weeks. And he has shortness of breath and oxygen saturation, it was about 85. And when we examined the chest, we have seen that he has bilateral fine end in his respiratory cavitation. Now in the COVID era, so the first differential diagnosis that jumped in our mind is COVID. There is too much corruption in the COVID era. We neglect many cases. For example, extrapulmonary TB, HIV, many cases, inflammatory bowel disease, and all this one because we were concentrating on the COVID. And we admitting the patient. This patient came by his father as his owner, the caregiver for him, and he brought him to our hospital, admitting him in Ward 10. The Ward 10 was responsible about the COVID. So a couple of days, the oxygen improved and little improved, and many swabs they didn't prove that he was COVID. But still fever is going on. That's why we shifted him to another ward in order to explore what is going on. So we send for the TB profile, as we suspect that it might be TB or HIV. So we send for TB profile getting us negative. But HIV, it was positive. Now the problem starts for the recently discovered HIV patient. And especially if you are a young doctor, you are working in the hospital and you discover that your patient had got HIV. So how to break this news, how to get sexual history, how to go through the family. Now we are in legal conflict that the father brought the son to our hospital. So he is a caregiver. He is asking you, what my son have? And the son is refusing for the father to know. So to go to wait. And at the same instance, we need support. And especially in recently discovered HIV patient, you need one family member support, father, mother, sister, but even you may need a friend. So we try to convince this boy. Primarily, we want to break the news. So we prepared ourselves that getting him aside, and we started to break the news. He collapsed and crying, and we expected the most important in a recently discovered HIV patient is the post-breaking bad news reaction. You cannot expect. So it's better for the young generations in order to break the news. Primarily, you prepare a place which is giving the privacy for the patient, and you have to sit down and prepare yourself first, because as we are doctors, we are getting stressed when you are going to face a case of HIV and you want to tell this young man about the HIV. Anyhow, we convince the boy that the father, he is the only support for you, he will support you. Even when we broke the news to the father even collapsed and getting post-breaking bad news reaction. So at the time, we supported him, and after 2-3 days, they start both. They are going through the journey of HIV treatment. This is. ده أحسن. And as we need the support, I still remember Mr. Ahmed, who came to our hospital by his wife, and he has been suffering of fever for a couple of weeks. And he has shortness of breath. When we examined him, we had found that he has pansystolic murmur in the tricuspid area and increasing with inspiration, what we call it Carvello sign. And this gives us that he has tricuspid regurg, and it's very rare to find a patient, a young male, and getting fever and the tricuspid regurg, so we suspect that this patient, he might have infective endocarditis, right-sided infective endocarditis. And the right-sided infective endocarditis in a young man, think about the needle sharing, and think about HIV and HPV. So we get history from him, including the drug history and sexual history, and he told a lot about how they share needles in the young people setting. So we get him, we diagnose him as an infective endocarditis, right-sided infective endocarditis. I think Dr. Hamdi was with us at that time. And then we sent for HIV. HIV came positive. But thanks to his wife, she supported him very, very well, and went with him through the route of HIV treatment. Nowadays, he is following the HIV clinic in Mbaba Fever Hospital and abstinence of addiction. And contrarily, we had been called in the early morning by the nurse staff there that there was one patient hanging himself in the bathroom. What hanging himself in the bathroom? And retrospectively, we get the history that the patient came the day before, afternoon, and he was having HIV. And because of the bad communication, or many things, factors rather than the bad communications, and he hanged himself. We found that the family was disturbed. The father was separated from the mother, and there was many disruptions. We meet the father and the mother, and we saw that maybe the family background was disturbed at that time. So the family support is extremely important in a patient with HIV. I think the early symptoms of HIV, although about more than 30% of the patient, you may discover it accidentally while they are making CBC, while they are coming bathing to you, that I have a little headache. So there is many cases that we discovered it accidentally. So the early symptoms of HIV, and even it is the early symptoms, it's trivial. Just fever, rash, arthralgia, runny nose, this influenza-like. And the HIV, as we know, that attack the immune system, and two main causes: the unprotected sex, the sharing injections. So if you find a case of HIV, you have to ask about sexual history, and you have to ask about the drug history. So it's extremely important, the drug history, because you want to eliminate the problem as a whole. You want to go through the multidisciplinary team approach. You want if you go to follow the patient in HIV clinic, also he is addicting, so he need rehabilitation program in order to abstinence from this addiction. So that's why Ahmed, he went to the way with his wife, no abstinence from the addiction. A clinician, they are interested in 3 stages of HIV. Stage 1, acute HIV infection, as general manifestations of the patient. They are coming usually in a fever hospital or in general hospital. Stage 2 is a chronic, and stage 3 is AIDS, which we don't want to go through this stage. This is some possible early symptoms. You might find nothing: fever, headache, muscle aches, skin rash, sore throat, painful mouth ulcers, swollen lymph node, diarrhea, weight loss, cough, and night sweats. Diarrhea, they are coming mostly the last case that gave a diarrhea, and we suspect that we put a differential diagnosis. He might have inflammatory bowel disease, blood staining stools, and loss of weight. So some people, they thought this is inflammatory, maybe ulcerative colitis, Crohn's disease, but we have to rule out before telling this diagnosis, you have to rule out the infective causes of colitis. So how to deliver the bad news, especially when you face a newly diagnosed HIV patient, how to deliver this bad news? It needs skills, because you know that you are the one that you put your patient on the treatment track. So in Baba Fever Hospital, practically speaking, we prepare a room, a small room, and this small room put chairs, 2 chairs in it, and making it for the breaking bad news room. Not only the HIV, but also cancer, because we might need last one, we had a cancer rectum, so we have to tell the patient that he has cancer rectum. So prepare this room, and this room we kept it for the breaking the bad news, whether cancer, whether HIV, whether extrapulmonary TB. And as I told, that there are many protocols for the breaking bad news, among of which that spikes. Most of the people, they're going through this spike. What the spikes means, that spike S means sitting. So prepare the sitting. Arrange for some privacy for your patient, and involve significant others. What involves significant other? So usually the patient in the early stage of HIV, he's fragile, and invite him to invite somebody with him if he wants, like the father, the mother. You want anybody to sit with you just for support. If you didn't find, you may get nurse, or you get some from the hospital. So involve significant others. While you are breaking the bad news for HIV, don't break it and you are in a hurry stage. This is not good. They are bad breaking news. Just get inside, sit, make mobile off. Don't be disturbed by anything. If you are busy, so postpone the meeting with your patient. So get inside, sit, and prepare yourself before you entering the room. What my agenda, I will tell the patient. What is the social culture of this patient? Because you know that different varieties of the people. You may find a newly graduated engineer. You may find a laborer man. So you have to know to what basis you are going to speak with, and make connection and establish a rapport with your patient. Not only verbal, but non-verbal. The patient gets sense when you are looking at him by your eyes that you are taking care with him. So the eye-to-eye contact is extremely important. And don't tell him that you have HIV and your head is behind. This is not correct. So prepare the sitting before breaking the bad news in HIV. And of course, you will make your phone off and less interruption. The P stands for the perception. Get your patient to get his knowledge. Yani, what do you know about your case? Let him what he perceived from other doctors, from other people, from other neighbors. So to assess to which level you will going to discuss. So get what he perceives before. So the B is a perception. Determine what the patient knows about the medical condition, what he suspects. Because I want to discuss with him to which level I will discuss. He doesn't know anything, or he know a part, or he know a disturbed knowledge. So from this instant, I have to ask about the perceptions for his condition. Then invitation. Invitation means that you will ask the patient. You are the type that you want to know more details about your condition, or you want the chunks from your condition. Because some patients, they do not want to know the details of the condition. Don't tell me the bad news. Don't tell me, please. Don't tell. Okay, I respect this one. But there are many patients, they want full detail. Speak about what I have, what I will do in full detail. So invite the patient, and does he wish to know all the details about his disease, and accept the right not to know and what he wishes. The knowledge. Now we came to the knowledge. The knowledge in patient recently discovered HIV, and you have, your tone must be low little, your eyes must be concentrated on him, you are getting him what they call it empathy. Be empathetic rather than sympathetic. Sympathetic is compassionate with the patient, but empathetic, put yourself in his own. If I am young like that, and if I catch HIV, what I would like the people to treat me. So knowledge given in a small chunks, in a communication skill, in verbal and non-verbal. And take in consideration when you are going to give the knowledge, that after you break the bad news, you cannot expect what is the post-breaking bad news reaction. If you tell a young man, he is newly graduated, young man, commerce, doctor, pharmacist, anything, that you have an HIV, and pause. When you break the bad news, get pause. Don't complete. See the reaction, because you might find that your patient is getting afraid. You might have that your patient is getting panic. You might have your patient anxious, depressed, dissociated, and many post-breaking bad news, as we describe the example that the patient is kill himself after the breaking bad news. So take a consideration. For me, I have did communication skills for more than 30 patients of HIV. The most important point in delivering the bad news is the post-breaking bad news reaction. He might hit you, he might get angry with you. So prepare. We did some courses in Mbaba Fever Hospital regarding the communication skill, how to deliver the news to the patient, whether HIV or other. So the knowledge must be, and use the intelligible language. Use the language of the patient. Yani do not go to the jargon. The jargon is a complicated, sophisticated medical knowledge. No, be simple as the patient he doesn't know what you are meaning. And to finally, this explore the emotion we spoke about, and finally to put a strategy and to put a summary to be sure that your patient has grasped your knowledge. So this is post-breaking bad news reaction, a psychological symptom, physical symptom, shock, denial, disbelief, confusion, difficulty in concentration, angry, irritability, anxious, guilt, withdrawal from other feeling. This is normal. We are human beings. This is a normal reactions that we are expecting. So for young generation, when you face an HIV, we have to learn how to deliver the news, especially for the newly diagnosed HIV patient. The second that we are not trained enough is a sexual history. The sexual history, most of us find difficulty in taking a sexual history, but truly when you are taking a sexual history in a patient with HIV, but in a way of empathetic, in a way of eye-to-eye contact, he is getting a friend of you and he explore. Most of the patients coming in the sexual history, I didn't do anything. I didn't have any extramarital exposure. I didn't have any partner. No, when you go through and you speak him in a communication skill, he will explore many, many things. I astonished that many Many patients, in the first instance, they come to us and they deny any sexual relation. But after getting with them, sedating them, they get confident of us. They explore many, many stories. There are many, many stories among of them. The sexual history, we can put it 5 P's. The partners. First P is a partner. The partner is male or female. The partner is one or multiple. The partner is permanent or casual. And believe me, we took this history there. We find many people that it seems that he has no partner. When we got a communication skill, he has many partners, male and female. And we shocked because the sexuality diversions is too much nowadays, especially homosexuality nowadays. Finished? 1 minute? 2 minutes? So 1 minute, 1 minute? 1 minute, 2 minutes? Okay. Quickly, back quickly. مش عربي. The prevention of the pregnancy, we have to ask the female about the pregnancy and the protection. He's using safe sex or not, and the practice, is it vaginal, is it oral, is it anal, and ask about the past history of sexual transmitted disease, because we have seen many patients, they have a gonorrhea, they have a syphilis, they have many, many things, the sexual transmitted disease. Partner we spoke about, and factors associated poor adherence. So when you are getting a communication skill nice, you will get your patient to be in a good adherent and is going through the journey of the HIV treatment journey. There are some strategies to improve the adherence. I think the first is to speak with the patient and to communicate and to understand what he wants. And thank you very much.